Is it healthy to give up salt? Yes, giving up salt can be healthy, especially if you are at risk of developing high blood pressure or other health problems. However, it is important to do this gradually and under the supervision of a doctor. What are the benefits of giving up salt? The benefits of giving up salt include lowering blood pressure, reducing the risk of heart disease, stroke, and kidney disease, improving sleep, increased energy, and losing weight. How do I stop eating salt? There are a few things you can do to cut back on salt. Read food labels carefully and choose foods that are low in sodium. Cook with fresh herbs and spices instead of salt. Avoid processed foods, which are often high in sodium. Gradually reduce the amount of salt you add to your food. If you're considering giving up salt, it's important to talk to your doctor first. They can help you create a plan that is safe and effective for you. Giving up salt, or significantly reducing your salt intake, can have both positive and negative effects on your health. Let's discuss the positive effects. Reducing salt intake can help lower blood pressure. This is especially beneficial for people with high blood pressure, as it can reduce the risk of heart disease, stroke, and other health problems. A low-sodium diet can also help improve kidney function. It can also help reduce the risk of osteoporosis, as salt can leach calcium from the bones. Now the negative effects. Too little salt can lead to hyponatremia, a condition in which the sodium level in the blood becomes too low. This can cause symptoms such as fatigue, confusion, muscle spasms, and seizures. In severe cases, it can be fatal. A low-sodium diet can also make you feel dizzy, especially if you're active or if it's hot outside. It can also make you crave salty foods, which can make it difficult to stick to a low-sodium diet. The amount of salt that is safe to eat depends on your individual health needs. If you're healthy and don't have any health conditions affected by salt, the American Heart Association recommends consuming no more than 2,300 milligrams of sodium per day. If you have high blood pressure or other health conditions, you may need to reduce your sodium intake even further. Your blood pressure may drop. This is because salt can raise blood pressure, so reducing your salt intake can help lower it. You may have less fluid retention. Salt helps your body retain fluid, so reducing your salt intake can help you get rid of excess fluid. You may have less bloating and swelling. This is also associated with fluid retention. You may have fewer muscle cramps. Salt helps your muscles contract, so reducing salt intake can lead to muscle cramps. You may have fewer headaches. Salt can also trigger headaches, so reducing salt intake can help prevent it. You may have a better taste for food. Your taste buds can become more sensitive to the natural flavors of food when you reduce your salt intake. Let's explain more about nausea and vomiting. This is because your body is trying to get rid of the excess salt. Muscle weakness and fatigue. This is because your muscles need sodium to function properly. Confusion, dizziness. This is because low levels of sodium can affect the brain. Seizures and coma. In severe cases, low sodium levels can be life-threatening. That's enough by my side. If you have any query, let us know and comment. Don't forget to subscribe, share and watch full videos.